My name is Colleen Brunetti, and I was diagnosed with pulmonary arterial hypertension in 2008. So I've been living with it for a little over 16 years now. So I have to lug around a fairly large nebulizer at all times, and I was looking forward to the possibility of not having to do that anymore. Not only the weight and the management, but like just getting through security at the airport was a challenge with it. And the time that it took and the space that it took up. After having been on that medication for well over a decade at the time, I was looking forward to maybe a little bit of relief and was willing to work hard to get it. So for the longest time, I couldn't do any clinical trials. I am sort of an anomaly in that I walk too far for how sick some of my other metrics say I am. So I was often excluded from them based solely on that requirement where you couldn't walk past usually about 450 meters or so. However, being very involved in the PH community and always on the lookout, I came across a research poster for a trial that I was very interested in taking part in, and basically just chased down a center that would take me. I wanted the medication very badly. So I had to keep a journal every day of the medications I was taking and how often, and stay in close contact with the trial coordinator, and then go down at predetermined intervals on the train. Or once COVID hit, I started to drive in order to do a full workup of 6-minute walk and blood work and physical exam, and just talk about how I was adjusting to the change in medication. I was able to do telehealth for a while during the worst of it, which was extraordinarily helpful. Although I understand that, we need eyes on us a little bit more closely in person, especially PH patients who tend to be a little on the fragile side. But being able to combine telehealth and then also having the trial allow me to stay overnight at a hotel did help. I tried my heart out to stay on it. Actually, 2 years I stayed in it. And the problems I were having were all related to side effects. And so we tried everything we could to make those side effects less impactful. And ultimately, I had to drop out just before it was approved. But I am glad I did it. I've been sick a really long time. And I know to my core that I'm only alive because other patients put their bodies and their time on the line to move science forward. And without them, I wouldn't be here, because every time I've needed a new medication or something new to try, something has come on the market right around the same time. And that only happens because trials are happening and other patients did it. So I'm not sorry I did it. I'm sorry it didn't work out for me, but I'm really hopeful that a lot of patients that, I'll never even meet are benefiting from it. When you look at clinical trial data, it's sort of a summary of how everything went, right? You're looking at percentages and numbers and averages and means, and those are great, but they don't show the individual experience. And so it can be twofold. I can come to another patient and say, hey, I went through that too. Here are the things we tried, which you can, of course, try, but don't feel bad if it doesn't work, because it didn't work for everyone. And I've actually been able to talk to some doctors too and help them understand a little bit more about what their patients might be experiencing that were a little off the formal record. I think if you're at a larger center, it's easier to find out about them because they're more likely to be run with a dedicated research coordinator and all of that. It's the smaller centers that do have a little bit more of a challenge. So if those centers could be proactive in letting their patients know, hey, if you're willing to travel a little ways, this is available to you. I certainly would say consider it. It's a large undertaking. It's a little bit nerve-wracking. But I think what people really need to understand is that you are in the best hands while you're in a trial. So you have your own medical team and your regular care. And then on top of that, you have the research team. And they may be one and the same. But for me, I had both. And so they're not going to ask you to do anything that ultimately you don't want to do or is not in your best interest. And so you are always in the driver's seat. So if, like me, you finally, decide this isn't the right fit, you have the right to back out. And if you stay the course and it works out, imagine what you will have helped accomplish. So, talk to your medical provider, talk to your primary PH specialist, talk to the research team, talk to the friends and family that you're going to need to support you through it, and then, give it a serious consideration. We don't move forward if people aren't participating in trials. And it's extremely hard to fill a trial in a rare disease, small population when there's already a large number of treatments on the table that patients can choose from. In my opinion, those treatments are wonderful and they've gotten us this far, but they're not enough yet. And if we want to continue to see a better quality of life for patients, if we want to see better clinical outcomes, if we want to stop losing members of our community, which we still do far too often, we have to get involved in making that happen.